very important. We haven't had a health act for over a public health act or a review of it for over 100 years. And we're not up to date with the current threats to public health, or indeed the future threats. There's a clear and present danger for non-communicable diseases. Our public services are unsustainable if we don't tackle non-communicable diseases. The Office of Budget Responsibility said that by 2065 the cost of the NHS would be 1.8 times GDP if we didn't do something about it. So we have to reduce the demand of these diseases. A Public Health Act is one way of ensuring that prevention's at the forefront. The Welsh have got miles ahead, and they're thinking about future generations, and they've introduced a whole range of public health acts, including having health impact assessment across all policies. They're looking to introduce MUP with what powers they have, and hopefully that will be supported by the Westminster government. But also they've given a duty to authorities to say that you really should consider the health of your population and the planet, and particularly for future generations, you should consider that in all decisions that you make. So they are very forward thinking, and I think we should adopt the Future Generations Act across the whole of the UK. It's incredibly well thought through. I think when people think mostly of chronic diseases, they think of the risk factors, alcohol, tobacco and ultra-processed foods, and they usually think of them as behavioural risk factors. They are behavioural to an extent, but the major determination of them as risk is they are social risks, and they are what we call commercially determined, usually because these are products that are marketed ubiquitously for consumption, and they are the major causes of non-communicable diseases, which account for most of the deaths, most of the morbidity, the ill health on the National Health Service, disability, reduced healthy life expectancy, and a major contributor to and consequence of health inequalities.